You wake up, look in the mirror, and those bags under your eyes are back, even though your blood work, heart, and kidneys all came back fine. In a huge number of cases, that puffiness has less to do with sick organs and more to do with how fluid and lymph move through your face and neck, especially how tight that neck of yours actually is. And here's the strange part. About a third of all the lymph nodes in your entire body sit in your head and neck. So even small blockages up there can show up right under your eyes. If you want clear, straight-talking explanations like this on a regular basis, subscribe and hit like. Dr. Waterling is aiming for 300,000 subscribers, and you genuinely help that happen when you tap those buttons. Checklists and extra health posts go up on my Telegram channel, and you can jump in anytime by scanning the QR code on screen. Let's start with a simple idea. Not every puffy lower eyelid means your kidneys are giving up. Doctors call swelling around the eye periorbital edema, and that swelling can come from all sorts of things. Allergies, local irritation, infections, thyroid disease, kidney problems, and more. Medical reviews point out that swelling of the eyelids can be a harmless reaction or an early warning of a serious systemic illness. So you never want to treat every case as purely cosmetic. At the same time, a lot of what people call bags are just normal age-related changes in fat and skin around the eye, not fluid at all. Think about what you actually see in the mirror. If you have periorbital edema, again, just extra fluid around the eye, your eyelids tend to look puffier in the morning and then settle down as the day goes on. The puffiness feels soft when you press it gently, and it often gets worse after salty food, poor sleep, or a night with more alcohol than usual. Age-related eye bags, on the other hand, are more like small, permanent bulges of fat and loose skin that don't really shift through the day. Cosmetic and eye surgeons keep pointing out that mixing these two up leads to wrong expectations. Creams or massage won't melt a fat pad, and surgery won't fix swelling caused by fluid retention. Now to the kidney myth. Kidney disease absolutely can cause swelling around the eyes because the body hangs on to fluid when the kidneys aren't filtering properly. But in classic kidney-related edema, you usually see swelling in several places at once. Eyelids, legs, sometimes the abdomen, and you often have other signs like foamy urine, fatigue, or high blood pressure. Reviews on eyelid edema say it plainly. Chronic swelling of the lids deserves a broad look at the whole body, not just an ultrasound of the kidneys. So if your nephrologist and your blood and urine tests all check out, you and your doctor can reasonably start looking elsewhere. The heart story is similar. In heart failure, blood backs up in the venous system, pressure inside the vessels rises, and fluid leaks out into the tissues, especially in the lower legs. That's why classic heart-related edema shows up first around the ankles and shins, and often gets worse toward the evening after you've been upright for hours. Swollen eyelids can happen in people with advanced heart problems, but isolated puffy eyes with no shortness of breath, no leg swelling, and no real drop in exercise tolerance aren't the textbook picture of heart failure. So again, if a cardiologist has cleared you, you're allowed to ask, what else could be driving this? When you step back, the list of possible causes is long. Eye specialists and internal medicine reviews list infections, allergies, inflammatory conditions, trauma, sinus disease, thyroid eye disease, kidney problems, liver disease, medication side effects, and even autoimmune diseases as possible reasons for eyelid swelling. Allergic reactions are especially common. Pollen, cosmetics, eye drops, or even your pillow detergent can spark local inflammation and fluid buildup around the eyes. Infections like cellulitis, styes, or conjunctivitis can also leave you with a red, painful, swollen lid, and those need actual medical care, not a massage video. Lifestyle is a heavy hitter too. Several medical summaries point to the same pattern: short or irregular sleep, high salt intake, frequent alcohol, and smoking all push fluid retention and make blood vessels more fragile, and the thin skin around your eyes shows those shifts first. Dehydration can make it worse because your body then tries even harder to hold on to fluid, including around the eyes. Chronic nasal congestion and sinus issues can also block drainage from the area around the eyes, leaving you with a puffy look, especially in the morning. These are all things worth mapping out with your own doctor rather than shrugging and saying, that's just my face now. Let's talk about fat pads and Malar bags for a moment. As you age, the thin skin around your eyes loses collagen and elastin, the proteins that give it strength and stretch, and the ligaments that normally hold back the fat around the eyeball start to weaken. When that happens, the fat can push forward and create a soft, permanent mound under the eyelid or along the upper cheek, what doctors often call a malar bag. Surgeons warn that chronic eyelid edema can look very much like these age-related changes, and that mistaking one for the other leads to treatments that don't match the real problem. One simple home clue: if the bag stays the same from morning to night for years on end, it's more likely anatomy and aging than fluid flow. And that's a conversation for a dermatologist or plastic surgeon, not a lymph massage tutorial. Here's a basic home check with all the usual caution. If your lower eyelids are clearly fuller in the morning, then slowly settle as you start moving and flare up after salty dinners or long nights, you're probably dealing at least partly with fluid and lymphatic congestion. If the fullness is stable, firm, or has been sitting there since your 20s with no daily change, anatomy is probably playing a bigger role. But this is only a rough guide. Actual diagnosis still belongs to an eye doctor or primary care doctor, especially if anything about the swelling feels new, one-sided, or painful. Now, the part most people never hear about: lymph. Your lymphatic system is like a slow, quiet drainage network that picks up fluid, proteins, and waste from your tissues and returns them to the bloodstream. Unlike your blood, which the heart pumps, lymph has no central pump. It moves because your muscles contract, your chest expands and relaxes with your breathing, and your tissues gently shift when you move. Standard anatomy sources estimate that adults carry roughly 600 to 800 lymph nodes, and a big chunk, around a third, sits in the head and neck. That heavy concentration makes sense. Your head and neck pack a brain, eyes, ears, sinuses, salivary glands, thyroid, and a lot of immune tissue into a very small space. Around your face, lymph vessels from the eyelids, nose, and cheeks drain into several key node groups: preauricular and parotid nodes just in front of and around the ear, submandibular nodes under the jaw, and submental nodes under the chin. From there, lymph flows down into the deeper cervical nodes that run alongside the big veins in your neck. Teaching texts show that the area in front of the ear and the parotid region collect lymph from the outer eyelids and the side of the face, while the submandibular region handles much of the mid-face and upper lip. If those zones stay mobile and soft, fluid leaves your face easily. If they're tight, scarred, or chronically squashed, fluid pools upstream, which on your face looks like a puffy lower lid and sometimes a thicker jawline. One muscle shows up again and again in neck anatomy: the sternocleidomastoid, the long band that runs from just behind your ear down to your collarbone. It helps you turn and tilt your head, and deep cervical lymph nodes sit just in front of and behind this muscle along the path of the jugular vein. When your head spends the day in a forward phone posture, chin poked out, neck bent toward a screen, this muscle often stays tense and shortened for hours on end. Physiotherapy and anatomy materials warn that chronic tension in this region can press on nearby soft tissues, including vessels and lymphatic pathways. If you picture your lymph flow like water in a hose, that tight muscle acts like a thumb on the hose. Fluid backs up above, and the first thing above it is your jawline and the skin under your eyes. There's a pattern from clinical practice that makes this very concrete. Picture Linda, a woman in her mid-50s who works at a computer all day and scrolls her phone on the couch at night. Her heart tests, kidney tests, and thyroid labs are all normal, but every morning she wakes up with a swollen, heavy look under her eyes and a soft second chin. In therapy notes from cases like hers, physical therapists often describe stiff, tender tissue along the sides of the neck and around the ears, and limited neck extension from that constant forward head posture. When they slowly work on neck mobility, breathing patterns, and gentle lymph drainage over several weeks, the morning facial swelling often eases. Not because anyone detoxed her, but because the fluid finally has a clearer route out. So when do gentle, lymph-focused techniques even make sense to talk about? And when do they not? Evidence around the head and neck suggests that manual lymphatic drainage, a kind of very light, rhythmic massage, can reduce post-surgical facial and neck edema and improve comfort after certain procedures. Other studies hint that lymphatic techniques and connective tissue work around the neck may help some people with pain and swelling, although the research is still maturing and isn't aimed specifically at cosmetic eye bags. The key detail is that these methods use light skin stretching, not deep pressure. And trained therapists emphasize safety and proper screening first. This is exactly the type of approach you might want to bring up with a physiotherapist or dermatologist if your swelling seems linked to posture and mild fluid retention, not infection or systemic disease. Red flags come first, always. Ophthalmology sources list a clear set of warning signs for eyelid swelling: strong pain, marked redness, fever, feeling sick overall, vision changes, double vision, trouble moving the eye, or one eyelid suddenly much more swollen than the other. Those can point to serious problems like orbital cellulitis, severe allergic reactions, or blood vessel issues that need urgent in-person care, imaging, and prescription treatment. In those situations, you don't touch the area at home. You go straight to medical evaluation and let the professionals handle it. If your doctor has ruled out the dangerous causes and you're left with chronic, soft, mostly morning puffiness, then lifestyle and gentle mechanical factors sit higher on the list. Eye and internal medicine reviews repeatedly call out poor sleep, high salt intake, alcohol, and smoking as changeable factors that worsen fluid retention and eyelid swelling. Chronic allergies and nasal congestion come up over and over too, including seasonal pollen, dust mites, or chronic sinusitis. It may be worth asking your doctor to walk through your habits, your medications, and your environment with exactly this question in mind. What here could be keeping fluid around my eyes? On the endocrine and systemic side, thyroid disease, especially autoimmune thyroid conditions, can change the tissues around the eye and lead to swelling or bulging. Chronic kidney disease, nephrotic syndrome, liver disease, and severe heart failure can all produce fluid retention that shows up around the eyes and in the legs. Rheumatologic and autoimmune diseases can involve blood vessels and soft tissues around the eyes as well. Guidelines on eyelid edema recommend at least one thorough medical workup when you have persistent, unexplained swelling, instead of just chalking it up to stress or age. That's a fair request to bring to your primary care doctor. Now, if you do end up in that relatively safe zone, chronic, mild, symmetric puffiness, no scary symptoms, big diseases checked and controlled, there are two anatomical areas that many lymph-focused clinicians pay special attention to: the region around the ears and the sternocleidomastoid muscle along the sides of the neck. As we said, the nodes in front of the ear and near the parotid gland receive lymph from the outer eyelids and side of the face, while nodes under the jaw handle much of the lower face and lips. Manual lymphatic drainage protocols often start by opening the lower neck and collarbone area, then the sides of the neck, and only after that moving up to the face, so the fluid has somewhere to go instead of getting trapped higher up. A typical gentle technique around the ear, as described in lymphatic massage guides, might look like this when a therapist demonstrates it. You rest your hands lightly over the ears and the tissue just in front of them, and you make slow, small, skin-stretching movements, as if you're softly shifting the skin rather than kneading the muscle. The pressure should be no stronger than petting a cat or dog. If you push so hard that the deeper tissue hurts, you're doing something else, not lymph work. Case descriptions report that after a few minutes of this kind of work, some people notice their temples and upper cheekbones feel less puffy, which fits the anatomy of that drainage pathway. If this interests you, it's exactly the sort of thing you can ask a trained therapist to demonstrate so you know you're doing it safely. The other zone is that sternocleidomastoid muscle. You can usually see and feel it when you turn your head slightly and tense the neck. It stands out like a rope from behind your ear down to your collarbone. Deep lymph nodes and major veins run right alongside it, and gentle work there aims to relax the muscle and free up the tissues around those structures. Some self-drainage guides teach a move where you lightly pinch the muscle between two fingers and slowly slide your hand downward as you turn your head, always staying inside a comfortable, pain-free range. Physiotherapists insist that you stop right away if you feel sharp pain, dizziness, or any breathing difficulty, and that people with vascular disease or neck instability really need individual guidance first. This is exactly why any such technique should be cleared with, and ideally shown by, a professional before you make it part of your routine. Why start at the neck instead of just rubbing the skin right under your eyes? Lymphatic therapy training makes a clear point. If you don't open the main drainage basins at the collarbones and neck first, you can push extra fluid toward nodes that are already congested. That can leave you feeling more pressure and heaviness, at least temporarily, especially if your deeper pathways aren't moving well. Starting low and working upward follows the actual direction of lymph flow, from the face to the neck, from the neck to the larger ducts, and from there back into the bloodstream. It's a simple idea, but it completely flips the usual instinct of rub where it looks swollen. Breathing and movement also matter more than most people realize. Deep belly breathing, where your lower ribs and abdomen expand, helps the main lymphatic ducts in your chest shift pressure and pump fluid along. Gentle neck mobility, regular walking, and not spending 12 hours with your head craned toward a screen all support better lymph flow, according to physiotherapy materials. None of this is glamorous, but when you combine it with attention to sleep, salt, alcohol, and allergies, you often see small but real improvements in how puffy your face looks in the morning. These are exactly the habits you can sit down and discuss with your doctor or physical therapist as part of a plan built around your own health history. Age changes the rules. As you get older, the skin around your eyes naturally becomes thinner and the supporting tissues loosen. Studies note that areas with thin skin and loose connective tissue, like the eyelids, swell more easily when your fluid balance is off, especially in middle age and beyond. On top of that, your lymphatic system can become less efficient with time, much like your veins and joints. That means a 30-year-old and a 65-year-old can eat the same salty meal and have the same bad night of sleep, but the older one may wake up looking far more swollen. How old are you, and do you feel like your face holds onto fluid more than it did 10 years ago? Your age really does shape how aggressive you and your doctor may want to be about hunting for systemic causes versus focusing more on tissue support and realistic cosmetic expectations. There's another pattern that shows up often in primary care records. Someone like Mike in his early 40s comes in worried about huge bags under his eyes. He drinks heavily on weekends, eats a lot of takeout, sleeps about 5 hours a night, and pops over-the-counter painkillers most days for headaches. His exam shows mild, soft eyelid swelling and nasal congestion, but his heart, lungs, and basic labs look okay. In situations like that, clinicians usually start with the alcohol, salt, sleep, and nasal health. Not because lymph and neck tension don't matter, but because those bigger levers drive fluid balance everywhere in the body. Only once those pieces start to move does it really make sense to fine-tune posture, breathing, and lymph drainage to squeeze out the extra benefit. So what does a sane, science-based next step look like for you if these bags under your eyes are bothering you? 1, if you've never had it, talk with your doctor about a thorough check for the major systemic causes: kidney function, liver function, thyroid status, heart health, autoimmune risk, and any medications that might be feeding fluid retention. 2, go through the lifestyle checklist together, covering sleep hours, salt, alcohol, smoking, hydration, and allergy or sinus symptoms, and see what's realistic for you to change. 3, if the main findings point toward mild fluid retention and muscle tension, ask whether a referral to a physical therapist or other qualified provider with head and neck lymphatic experience makes sense. If a specialist has already told you that what you're seeing is mostly fat pads and loose skin, not fluid, you can move the conversation toward cosmetic options and skin support instead of chasing every drainage hack online. In that case, dermatologists and oculoplastic surgeons are the people to ask about procedures, not YouTube. And if at any point your eyelid swelling suddenly changes character, turns painful, red, one-sided, or comes with fever or vision changes, you already know that this isn't a self-massage situation. That's an emergency or urgent care situation. The bottom line is straightforward. Those bags under your eyes aren't random, and they aren't always a verdict on your kidneys or your age. You can treat them as a visible clue about fluid balance, lymph flow, posture, sleep, and deeper health, and then use that clue to drive a smarter, calmer conversation with your doctor. It's worth asking about lab work and risk factors, worth exploring gentle work on your neck and around your ears with a qualified therapist, and worth tuning your habits so your face doesn't have to carry the whole story of your lifestyle every morning. Everything here is meant to give you better questions and clearer ideas for that conversation. It isn't a substitute for a real exam and a plan built specifically for you. If this helped you see your eye bags in a new light, subscribe and tap like. That's how Dr. Waterling gets closer to that 300,000 subscriber mark and can keep producing deep dives like this one. For practical checklists and shorter health tips, scan the QR code on screen to hop into my Telegram channel.